The first major part of healthcare reform that is scheduled to kick in January 1, 2014 is the individual mandate. The individual mandate requires most Americans have some sort of health coverage or pay a penalty or tax. The penalties will be the greater of a flat dollar amount or a percentage of the person's income. Both the flat dollar amounts and the percentages increase over 3 years. The flat dollar amount is assessed on a per person basis. In 2014, the amount is $95 per person and then increases to $325 per person for 2015 and then goes to $695 per person for 2016 and beyond. If the person is 18 years or younger, the amounts are cut in half. Also, the maximum penalty assessed against a family is capped at 3 times the per person amount. The percentage of income penalty also is phased in over 3 years. Those percentages are 1% for 2014, 2% for 2015, and 2.5% for 2016 and beyond. The applicable percentage is assessed against the individual's household income less the taxpayer's exemptions and standard deductions. The individual mandate penalty is to be reported on the person's Form 1040 when they file their federal income tax return. However, the IRS is precluded from assessing levies and filing criminal charges against those that fail to pay the penalty. The only option available to the IRS is to offset or reduce any refunds by the amount of the individual mandate penalty. So, if the person is not going to receive a tax refund, the government may not be able to collect the individual mandate penalty. The following example shows how the individual mandate penalty will apply. Sue and Bob are married and have one child aged 16, and they do not have health coverage, and they are not otherwise exempt from the individual mandate. Their combined household income after exemptions and standard deductions for the 2014 calendar year is $65,000. Since they do not have coverage and they are not otherwise exempt, they are subject to the individual mandate penalty. The penalty will be the greater of 1. The flat dollar amount method, i.e. $237.50, equals $95 for Sue, $95 for Bob, and $47.50 for their child. Or 2. The percentage of income method, i.e. $650, which equals $65,000 times 1%. So in this case, the penalty for 2014 under the individual mandate would be $650. The intent behind the individual mandate is to encourage people to have health coverage. This is critical to the insurance companies from an underwriting standpoint. Starting in 2014, healthcare reform precludes carriers from imposing pre-existing condition exclusions. This means that carriers cannot deny benefits for any pre-existing condition. As a result, it is imperative for the carriers that individuals be forced to buy coverage. Otherwise, everyone would wait until right before they are going to incur claims to purchase the coverage. The individual mandate is designed to spread the risk across a wide population by requiring everyone to have health coverage. However, as a practical matter, the penalties under the individual mandate are too low to accomplish that goal. As a result, many anticipate that over time the penalties will have to be increased to compel increased enrollment and to help pay for healthcare reform. To recap, the individual mandate is designed to compel individuals to have health coverage or pay a penalty. In reality, the penalties are too low to have any real teeth, and the IRS's ability to collect the penalty is limited.